Good evening to all. This is Vijay Lakshmi, the Secretary General of the Chamber. I welcome you all to this webinar. As Mr. Fanidhar was saying, that this is the need of the hour program that we thought that we should organize, start a small step to connect the industries with the today's crisis. COVID, as we have been hearing about the COVID-19 for the past 1 year, and since last month, the oxygen crisis has become more, and everywhere we are hearing the cries of, where exactly is the step, or where exactly is the problem, solution for this problem. And more so that there are, the media says that one side of it, that the oxygen is available for the people, but only thing is it is not being streamlined. In fact, yesterday I saw it in the news that there is a Supreme Court has set up a task force committee for this, to streamline the oxygen. And though somewhere we are hearing that the India has got a sufficient capacity of oxygen, but still it is not reaching the common man, and we have to know what exactly is the reason. That is also one of the reasons that we are organizing this program. And I welcome our president, and I welcome all the participants and the speakers, and I request our president, Dr. V.L. Indira, to please welcome and give the opening remarks on this important program. Over to you, ma'am.
Thank you. Good evening to all. On behalf of Andhra Chamber of Commerce, I welcome you all to the webinar panel discussion on how the industry can offer support to hospitals to tide over the oxygen crisis by creating additional manufacturing capacities. As we all know, the program is the need of the hour. I extend my hearty welcome to panelists of the day, Mr. Venkat Vanandikar, Advisor, Sri Venkateshwara Medical College Hospital and Research Center, Pondicherry, and Mr. J. Purushottaman, General Manager, Helix Private Limited, Andhra Pradesh, MedTech Zone, Vizag. I extend a warm welcome to Mrs. Rama Venugopal, Chairman, Startups Entrepreneurs Committee, and co-chair for Quality and Productivity Committee, Andhra Chamber of Commerce, who will be the moderator. The exponential surge in India's coronavirus infections over the past few weeks has swamped the healthcare system, seen patients dying in ambulances and parking lots outside hospitals, and overwhelmed crematoriums. COVID has taken the world by storm and is presently managing as a second wave, which has hit India amidship, turning over whole world topsy-turvy in the space of few weeks. We used to be prepared. We have to be prepared to learn from our experience, because the pandemic is not going to go away in a hurry. It has also drained supplies of medical oxygen, which is vital for those who have been infected. The dire shortage has turned out to be a major challenge facing hospitals in many states across the country. Today, I've read in the papers that Germany has bringing in a lot of oxygen into the country. Oxygen therapy is crucial for severe COVID patients, which hypoxemia, when oxygen levels in the blood are too low. The experts say India is producing enough oxygen at just over 7,000 tons a day. Most is for industrial use, but can be delivered for medical purposes. The Indian government has now directed most of the country's supply of industrial produced oxygen towards the healthcare system. Okay. Amid high demand, suppliers have been ramping up capacity to be able to produce more than 9,000 tons of medical oxygen by mid-May. Our medical infrastructure, which is not very robust, is already under serious strain due to the increasing number of infections. The vaccine supply is running short. We are once again short of oxygen and ventilators. While vaccine, the second wave of corona came to attack us once more. We should develop our immunity by practicing pranayama, yoga, and strengthen our respiratory system. To explore the possibilities with industries, whether they can offer support to the hospitals to tide over the oxygen crisis, by creating an additional manufacturing to tide over the oxygen crisis by creating additional manufacturing capacities and also to address the various concerns of the oxygen crisis. This program is organized. Now we see many of these pharmacies have also started to manufacture, for example, Covax at Hyderabad, Bharat, and lot of scientists are doing a lot of experiments to get over and supply vaccines because we have a shortage of vaccines in the country. So to sort of, excuse me, to sort of come over this, I think it's not only the vaccines, but oxygen is the first priority. So a lot of industries are looking at how to start small units of oxygen to supply to the hospitals. I would like to thank the speakers for coming in to do this program by various council of oxygen. Okay, but I would like to thank not only Rama Venugopal, but also Mr. Venkat Panandikar and Mr. Purushottaman, General Manager, Helix Private Limited of Andhra Pradesh MedTech Zone, Vizag, for organizing these programs for us. So I would like to say, stay home, stay safe. Thank you once again.
Thank you very much, ma'am. Thank you for that nice introduction. And I now invite Mr. Rama Venugopal to please introduce the speakers and start the program. Over to you, ma'am.
Thank you. Thank you, Vijayalakshmi. Is my voice audible, clear?
Yes, very clear, ma'am.
Yeah. Thank you. Thank you so much for that opening remarks, ma'am. So we do have two panelists of the day today, Mr. Venkat Fanidar, and then we do have Mr. Purushottaman. Let me just give you a background of the session. Ma'am has read out in detail the objective of this session. It all started with a lot of conversations that are happening around us on a daily basis, where we've been getting a daily cries of help from the communities, from the public, from the healthcare industry, from the various other stakeholders. The daily request for oxygen beds, O2 beds, or the concentrators. The maximum number of requests that are hitting us on a daily basis is for oxygen concentrators, and then refill cylinders. The request, the demand for the refill cylinders from the hospitals. And the numbers just increasing the last few months. This is the crazy numbers. And then the moment you actually get up in the morning till you go to bed, you know, the request for the O2 beds is increasing. You do have hospitals, you do have COVID care centers, and then various other hotels have got into this kind of facilities where they are creating some basic COVID care facilities also. But what is it that hospitals need? What we see in the conversations, what we hear, what we listen, what we see in the media, we thought it's better to have a first-hand request or information from the hospitals itself, the representatives of the hospitals, as to what has happened actually between the first wave and the second wave. None of us have actually been prepared for the second wave, and maybe I guess as communities we have taken many things for granted also. The second wave is actually hitting us from a 360-degree perspective, and we really do not know how many more other waves that we have to face. So when healthcare sector is seeking for some kind of help and assistance, maybe this is the time for non-healthcare sectors, the other industries, just to look into the needs and then see, you know, whether we can try to meet some of their requirements in a collaborative fashion. The whole purpose of this discussion is maybe the first of its kind that the chamber has initiated, just to create a connect and a bridge between hospitals and the chambers of commerce. Let us understand their needs and what they are looking for, their priorities and their wish list. And when we've decided to invite the hospitals, it also made us think, let us also invite manufacturers who are actually manufacturing. The maximum need today that we are hearing is for an oxygen concentrator. So we thought we will reach out to a manufacturer. So that's how we reached out to Andhra Pradesh MedTech Zone, one of the medical devices parks in the country, the most established medical devices park, and Chamber is also connected, one of the ecosystem partners there. So we have reached out to the MedTech Zone and requested whether there are any Indian manufacturers with a base there, and they said yes, they do have Helix Private Limited, and that's how they've connected Helix to us. So that's how we roped in a manufacturer also today, because we would like to see their version of the scale up and the ramp up. Industry is asking for ramping up of capacities, but then in the industry scale up and ramp up overnight is which we would like to hear their version also. Maybe as we go along, it's purely an interactive mode, a panel discussion where we would like to listen to the views of the experts. So let me just take the opportunity of introducing both the speakers. Madam, can I have the profiles on the screen, please? Yeah. Little Madam. Yes. So the first speaker of the day, Venkat Fanidar, and he's one of the senior most healthcare professionals who've been with the healthcare industry. And then he's part of a lot of industry initiatives and industry engagements. Facebook post very recently where he posted, that was the Facebook post by him triggered my to start this exercise. Then I just picked up, spoke to him, and I had an interaction with him. Then I suggested that can we do a session like this from our chamber, and he initiative, and maybe first of its kind, nobody thought about it. Why don't you please initiate the exercise, is what he said. So Mr. Venkat is just profile. He is an MPhil in hospital and health management systems from BITS, with almost about 2.5 decades of healthcare experience in leadership, P&L management, strategic planning, project management, business development, with core concentration on revenue growth and ROI. And, he started maybe his career from a 100-bedded hospital, and then currently managing a 1,800-bedded tertiary care setup, driving efficiencies to show year-on-year growth, and improving the bottom lines and the top lines and the mid lines also. And maybe some of his growth initiatives he was leading growth initiatives, both organic and inorganic, and with more emphasis on asset-light models, which is the focus area for any fresh investments into the country. Is any investor prefers to have an asset-light model. And so he's been instrumental in driving some of these asset-light models through operations and management contracts. So 360-degree aspects of enterprise journey by virtue of his involvement with setting up of several greenfield projects in India, including tertiary care hospitals and medical institutions, and journeyed through various stages of these businesses. Very outgoing personality. We all know, at least those who know him in the market and in the industry, we know him for his outgoing personality. Well connected to the healthcare and business fraternities, and he's been part of many such industry initiatives and industry forums in the healthcare domain. And not only in India, he's got global experience, and helping hospitals and health facilities outside the country. He's based out of Chennai, and he's got a wife and then 2 kids. He's also connected to through from his wife's side. One of the members of the chamber are also connected. So memberships and associations. He's panel member of FICCI, he was, and then CIA Tamil Nadu, and then TN chapter of AHPI, which is the strongest body for Association of Healthcare Providers of India. And he's a member of Hospital Administrators of India. And then he's also a member of CAHO, another vibrant platform for healthcare organizations. He's a guest faculty teaching maybe MBA students at Annamalai University. And then, so these are his other credentials. On the lecturing side, chairing and moderating various healthcare conferences, various institutions across the India, being part of the organizing committee of AHPI, CAHOCONs, all those conferences in healthcare, received awards from AHPI, and helping a lot of MPhil hospital management students and MBA students. And then this is his profile. Maybe we can share with the participants later. Welcome, Anita. Thank you so much for accepting our request and joining us today. Then can we have the next speaker's profile, please? Yeah. So the next speaker, next panelist today we have is Mr. Purushottaman, Mr. Janakiraman Purushottaman. So the Chennaiite, and he's from Chennai, but currently he's in Bangalore and maybe shuttling between Bangalore and Visakhapatnam. He's got about 35 years of experience in the medical industry, mostly associated with ventilators and other related products at various levels. So he's currently the general manager of Helix Private Limited, and that is where Helix is the manufacturing unit, which is situated inside the Andhra Pradesh Medtech zone. So he's a product for Triton ventilators, and he's also a senior consultant for R&D companies and various other teaching institutions. So he's a commerce graduate from Madras University, and he's also DEEE from state. He was a directorate of technical education in Tamil Nadu and a PG diploma in yoga education from Bangalore University. Close to about his 5 years of industry experience, maybe in various organizations and various companies in various capacities, from service engineer and role marketing head and a general manager. So his specialization is actually on ventilators and related products, including ventilator testers. And his focus is into product design and development and training on medical equipment, quality management programs on ventilators, which is this is needed in the country, where there is a focus now to train biomedical engineers on quality systems and regulations in the country. The personal strength is his knowledge associated with ventilators, test equipments and related products, practitioner of yoga and pranayama for a sound body and mind connect, conducted several training programs in India and abroad for biomedical engineers, nursing technicians and technicians. Maybe just come down a little, maybe some of his the work, the pictures are here. So thank you so much. Thanks, Madhuram. Welcome, Mr. Purushottaman. Thank you so much for accepting our request.
Thank you,
we thank Mr. Nandakumar also for accepting our request when we reached out to him and for nominating you. So thank you so much to the Helix team. We can just start the today's session. It is going to be a kind of an interactive format and a panel discussion. Before that, Mr. Purushottaman, you said you wanted to start off with a small presentation. You wanted to initiate before the discussion. You wanted to start with a small presentation, right?
Yes, madam. If you all, it's a small presentation.
Yeah, please.
If you all don't mind, it's a very basic presentation which I pulled out 1 hour ago.
Please. Please.
Shall we start? Can I start now? It won't be long.
Yeah, please.
And
please.
It is a very small, humble presentation, and I request people to read with me.
Yes. Okay, please continue. Thank you.
Madam, am I audible?
Yeah, very clear. Okay. Audible. You're audible. Yes, please.
Thank you so much. Thanks for this time. And this is going to be a very basic presentation, which I started. And I just analyzed how the present crisis can be tied over or supported. You all said oxygen is the natural drug right now, which is required for everybody. Okay. And now what we can do is conservation of oxygen during COVID. 1 second, just a minute. Yes, sorry. Conservation of oxygen during this COVID situation. Okay. Okay, we have got our head office at Bangalore and Helix Technologies at AMPSET, Vizag. Oxygen plant installation takes at least 30 days when done on warfoot basis. This is our experience. We started a couple of months ago installing a O2 plant at Vizag, and almost 60 days, and most of our team is there working day and night. And this plant will produce at least 300 oxygen per day. At this point of time, instead of manufacturing oxygen, what we can do is we can conserve oxygen and prevent leak hospital. At this point of, there are two ways. Conserving oxygen is also like earning or producing an oxygen. Equal to production, let us understand respiration and various types of oxygen cylinders. It's going to be very basic. I request you to tolerate with me. Let's understand respiration. Respiration has got one inspiration and one exhalation. That if it is 1 second, the exhalation it is 2 seconds. Suppose we are using 3 liters of oxygen from an oxygen cylinder. During inspiration, it goes to the patient. During exhalation, which is 2 seconds, almost 6 liters is going as a waste through the expiration. It is a wastage. Only one part of the 1/3 of the cylinder is used for a patient. That's what I'm trying to say here. If I'm going to say 3 liters per minute, 3 multiplied by 60, it is around 180 liters per hour is used for patient consumption. 6 liters per minute, which is 360 liters per hour, madam, it is a wastage during expiration. When the patient is exhaling, the flow which is coming to the patient, it goes along to the atmosphere as a wastage. The wastage is almost twice, 360 liters per hour. That means one B-type cylinder. Cylinder is a ward cylinder. You will see in any hospitals in a ward, they put it in a small trolley and they take it around. That means one B-type cylinder every 4 hours is getting wastage. That means 6 cylinders are getting wastage per day. Sorry. So O2 conservation device here will save the wastage. So what is a O2 conservation device? I really don't know what's happening. Okay. Oxygen conservation device will not only save the wastage, a single cylinder, instead of coming for 1 day, it may come to 4 to 6 days, one particular cylinder, because we are conserving the wastage. I would like to say what are all the various sizes of oxygen cylinder available at this point. Its volumes and capacities. See, these are all the 4 basic cylinders in the market. That is, A-type cylinder is the smallest cylinder used in anesthesia gas machine. The B-type cylinder is slightly, which is called a wad cylinder. The C-type cylinder is an intermediate cylinder. The D-type cylinder is a bulk cylinder used in the oxygen in the hospitals. So the color, body color is black, and the color is white. If the body color is black, the color, that means it indicates it's oxygen. The color always indicates what is the gas inside. Mostly used, the type is a B-type cylinder, which is called the wad cylinder. You see in the refilling station, people are standing in the queue with a small cylinder, moderate cylinder. That is a B-type cylinder, wad cylinder. D-type is the bulk cylinder that cannot be taken around. It is given to the hospital for the bank purpose. From the bank, it comes to various wards as a comes in through the pipeline, oxygen pipeline. These are all the color codes. So color of the gas inside the cylinder is indicated by the color. Types and volumes and capacities of a cylinder. See, A, B, C, D. A is which has got a water capacity of 5 liters. That means 5 multiplied by 150 kg. It has got a volume of gas around 750 liters inside. Let us take the B-type. B-type has got a water capacity of 10 liters. That 10 liters multiplied by 150 kg, it has got a volume of 1500 liters inside when it is fully charged. The formula here is water capacity multiplied the pressure in kg gives the volume of gas inside. At any point of time, looking at the pressure, you can always calculate what is the volume of gas inside the cylinder and you know when to keep the next cylinder ready once this cylinder is getting empty. A B-type cylinder, second please. Okay, a B-type cylinder is 10 liters is the water capacity. The pressure is 150, though when it is fully charged, it has got a volume of 1500 liters inside. Okay. So what is an oxygen conservation device? What you see over here is an oxygen conservation. This conservation device has got a pressure gauge, and it has got a flow meter over here, which says 1.5 to 2.53 up to 6 liters it has got. So you can set this flow and connect this directly to the cylinder. One probe is coming down. From this probe, the nasal cannula goes to the patient. So this is how the conservation device to the cylinder here. During the dosage is only during inspiration. During exhalation, the oxygen does not come out of the cylinder. Thereby, we are saving oxygen here. Oxygen conservation device on the right side, and you've got the left side. It is same thing is connected to the cylinder here. So what is the advantage of Sally? It is lightweight, totally automatic and reliable. The conservation is 5 times. That means if a cylinder comes for 1 day for one patient, same cylinder will last for 5 days. So that is a beautiful conservation. At this point of time, I think conservation device ought to be used and supported. Conserving O2 will save more lives. Cost of a conservation device is, the imported one will cost around 50K or more. I'm not very exactly sure about this. We have to find out from the net. Indigenously made will cost around 5K. We have already developed the prototype. It is in AMTZ. My boss Nandakumar is there. The prototype is a successful prototype. The beta prototype is going to come out soon, or probably it would have come out by now. And Helix has already developed. Contact person is Mr. Nandakumar. Nandakumar at helixindia.com. So and so, and you can be in touch with him. He will also help you to get the imported one if you really need to conserve the oxygen. Now we are going to see the second one is oxygen wastage in the hospital. The oxygen wastage in the hospital, you see there are so many number of beds over here, around 30 beds are there. Each bed has got a oxygen outlet. You see every bed has got an outlet. Every bed has got an oxygen outlet. So O2 wastages in the hospital, let us take 100 outlet are there in a particular hospital. 100 I have taken for easy calculation. Out 30% oxygen outlets are leaking. They are leaking around 2 liters per minute. 2 liters per minute is a very slow leakage. You can it won't be any hissing sound at all. 2 liters per minute means 2 multiplied by 60. That means around 120 liters is getting wasted per hour. That means for 30 outlets, it is 360 liters of oxygen is wasted per hour. That means it is almost 202 a B-type cylinder. For 24 hours, around 40 oxygen cylinders getting wasted due to leaks. The leak will save the oxygen. So silent O2 leakage of the O2 outlets is an unnoticed expenditure, and it is also an unnoticed wastage. Nobody will come to know about it unless you have a biomedical engineer who goes to each and every outlet and check the outlet for the leakage. Arresting the leakage will save the oxygen. Gas audit can be done by ultrasound leakage tester. It is not possible to import. So the cheaper method is to use a water tumbler under each outlet to see if the gas is bubbling through the water. If there is gas bubbling through the water, that means that particular outlet has got a leak. All that you have to change is the O-ring or the diaphragm or whatever it is. That is the maintenance program. By doing this maintenance, you can save oxygen. Conservation on oxygen and arresting the leak at the outlet are the only solution right now. From my point of view, I apologize. If there are any other things, people can come and say how you can conserve oxygen more. The contact person is Nandakumar. He's been in this line in gas alone, in medical gas pipeline alone, he's got around 30 years of experience. He's the one who told us to develop the oxygen conservation device. And Helix also we have successfully developed an O2 concentrator. The beta prototype is ready. The alpha is over. It is successful. We have already tested it for any number of days. You switch off and switch on. Within less than 2 minutes, it gives 94% of oxygen. It is going to be very less cost effective. It's available right now in AMTZ. Probably it is ready for supply from July onwards. Thanks, ma'am. Thanks for your time. Thank you, everybody.
Thank you. Thank you, Mr. Purushothaman, for setting the tone. The focus now is actually on oxygen audits in the country. This is what most of the state governments have asked. At least conservation and preservation is also one of the focus areas. Places like Maharashtra, where they have done this oxygen audits successfully, they have made statements that they were able to say possible. Yes, it is doable, but there is always also a burning issue on the other side, which we need to address also. So I just would like to start the session and maybe keep rotating a few questions between the panelists, and then I would like to understand and have your inputs also. Give me 1 second. Yes. See, normally the questions that we are seeing at the marketplace, I would like to, not that you're not aware of it, people are asking the kind of statements: we need oxygen concentrators, even provide a verified dealer or an importer or a manufacturer. Can you suggest which oxygen concentrator to buy? Do we have oxygen beds readily available for COVID patients? Do we have leads to the oxygen concentrator manufacturers in India? Do we have any reliable sources where we can get this oxygen cylinders refilled? Any suppliers that we have in various cities? See, these are all the questions that are thrown up in the conversations, daily conversations. Do we have the list of the suppliers available anywhere? Is there a portal where we can go and check? So can anybody suggest what is the oxygen? What is the oxygen mini plant, 100 liters or 250 liters capacity, which can be set up in a remote area? What is the cost? What is the time for delivery? Do we have manufacturers? Small hospitals and clinics need this mini oxygen plants. So is there anybody there to help hospitals? Then some people said oxygen concentrator is not that useful. With concentrator, the person can remain stable or may even slow down the deterioration of the condition. But what is needed is oxygen through cylinders, which is the more appropriate solution. Concentrator is a temporary solution, is a conversation. These conversations are also happening. Some people said, no, the intended use is different for an oxygen concentrator. So maybe like this, the list goes on and on. So we would like to hear from the experts today. So I just would like to start off asking very basic questions. Let me start with my questions to Mr. Venkat Fanidar. Mr. Venkat, you need to tell us whether all positive patients are they requiring oxygen supply today? All the COVID positive patients, do they require an oxygen supply today? We are talking about maybe the second wave now. When they need oxygen supply, do they need the supply in the home environment or in a hospital setup?
Yeah. Your question is over, Rama?
Yeah, just one more. The demand for the oxygen, whether the demand for this oxygen supply has gone up between the first wave and the second wave. That's it. Just 3 parts.
So first of all, thank you so much for making me a part of this very important initiative taken up by Andhra Chamber of Commerce. Okay. In fact, health is always having a very detached attachment with the rest of the industries. Okay, Rama, in the industry, you know very well, because we have our own ways and means of doing things. But we were saving people now and then also. But this is the first time that we are, in fact, we are trying to, get attached ourselves to the industry. Rather than that, you are trying to get attached to the healthcare industry to share your strengths, your resources, and your capacity to ensure that it will some help, okay, during this crisis that we are going through. This is really a wonderful initiative from Andhra Chamber of Commerce. And if this certainly, if this could even provide some solutions, if not for all solutions for this crisis, that will be a mammoth, initiative helping saving some lives. Okay, even one life matters for that. I appreciate and thank all those who are part of this particular initiative and who are all listening to my talk. So the first point, Rama, what you are telling, your question is that what is the percentage of people, all the people are requiring?
Yes. Yes.
No. See, the first wave, the peak was around 97,000 patients per day. And today, the peak is not at, we are not at the peak, and we have more than four times that number of COVID patients. 97 was the peak in the first wave, and today we are more than four times of that. Number one, when we were 97,000, the peak of the first wave, 41 to 42% of the patients who landed up in the hospitals were requiring oxygen supply. Please understand, for a lack of COVID patients at the peak, 41 to 42% of population who have landed up in the hospital were requiring oxygen.
Okay.
Whereas today it has increased by 13%. A recent statement by the government of India, the study says the requirement has increased by 13%. That is, you can't take it for 1 lakh, you have to take it for 4 lakhs. Okay, so there is a mammoth increase in the requirement of oxygen. That is number one. There is no doubt there is requirement of oxygen. But luckily, this time, if you compare with the number of COVID patients that we had last year in the peak, that is 1 lakh versus 4 lakhs now, luckily this time, the utilization of ventilators have come down. It doesn't mean it has come down in percentage, but pro rata, if you see 1:4, okay, the requirement is more, but the percentage of requirement has come down if you compare with the first wave. So now, typically what is happening today is, this is a very unprecedented and everything comes to us as a surprise in this second wave. People are doing very fine. See, we always ask patients, we always tell, and it is also to some extent scientifically proven that 95% of the patient need not necessarily go to the hospitals. Okay, they can just over the counter medication can take care of them. If they can be in isolation and to take good care of them, they will be out of this virus. But there is something, we are all in the era of misinformation and overloading of information. That thing, people get finicky, okay, they panic, and then they go and stand in front of the hospitals. This is one thing why the hospitals are not serving those who are actually in need of beds. Number one. Number two is, why are the second week of the onset of the symptoms, patients were doing very well this week, but suddenly even the younger generation, I'm listening every day, the distress calls come to me. At least I attend 20 to 25 calls every day from near and dear and friends and their friends, etc. People of the age between 25 to 49, okay, they are falling sick after 6th day. That is the second day. They're falling sick. Their oxygen levels are dipping, and they're having breathing problems, and they're looking for hospital oxygen beds. So this is where actually we are suffering. The hospitals are suffering by not able to provide this category of patients a bed, because suddenly we don't have the bed because they're already occupied. So that is number two. How we can, whether this oxygen concentrators of help, yes, anything that comes to has a certain degree of help, it can contribute a certain degree of help. There is no denial in that. Be it oxygen concentrator, whatever it is. You see, when you are hungry, okay, anything you see, if there is a proverb in Telugu, okay, I will tell, most of you must be Telugu people, but then I will tell, ఆకలి రుచి ఎరగదు, తర్వాత ఏదో నిద్ర వచ్చి సుఖం Okay, when you fall, you want to sleep, you don't even worry where you are sleeping. Okay, you just will sleep even under a tree on a bench. The same time when you're really hungry, you don't worry about what taste the food is. Okay, you need something to eat. So we are in that situation now. Whatever little help that comes in any form is of a great help in saving people today. Yes, this oxygen concentrators will help us, but they have their own limitations. What kind of limitations? They are power induced. They need electricity. So you need continuous electricity for running them, number one. Number two is they have limitation in terms of the discharge of certain liters of oxygen per minute. What generally happens is every liter of oxygen, normally a human being breathes in around 21% of oxygen from the atmosphere. So if you need 100% oxygen to an ailing patient, you have to keep around 20 to 40 liters of oxygen per patient in this oxygen, what we are about. So that means 1 liter of oxygen you are giving to a patient, okay, mechanic, that will increase the percentage of oxygen by 3%. So if we are talking a person is having 80% occupant saturation, and you have to bring it to 99 or 100% or even 96, you can calculate how many liters of oxygen is required for one individual. Oxygen concentrators can take care of patients who need from half a liter to up to 8 liters. In some cases, up to 10, that is what they are claiming. But the end of the day, it is the physicians who are supposed to be comfortable with what the delivery of the quality of delivery of those concentrations. A WHO report says that the annual consumption of these oxygen concentrators across the world globally is only 30 to 40,000, whereas the demand has increased 12 folds now. Every month we need 40,000 concentrators now. So definitely they will be of help if the patient requires anything less than 8 liters and no issues other than only oxygen, he can be managed at home. But then 5 to 6 liters would cost you around 50 to 60,000 rupees. Okay, I'm talking about a decent model, and if it's anything beyond 8 to 10 liters, that will be costing you over a lakh of rupees. So not everybody can actually afford this particular. So these are the limitations of oxygen concentrators, but notwithstanding the fact they will be of some help in patients.
Thank you. Thank you for that. Mr. Purushottam, like to taking off from Mr. Venkat's conversation, I just would like to know, because you have already established manufacturing facility at MedTech Zone. You made a mention that it takes about minimum 60 days, right, to set up the plant and keep it up, alive and going. We're trying to say that a manufacturing plant.
This is a refilling plant, filling oxygen cylinders.
Oh, it is a refilling. You were talking about the refilling plant.
Refilling plant to fill the oxygen cylinders. The plant we are installing right now at AMTZ will refill around 300 bulk cylinders per day.
Excellent. Okay. Will that cater to the requirement of the hospitals in Vizag?
I don't know, madam, what is the total requirement right now there. But our capacity on 24/3 shifts, it's around 300 cylinders. Right now, as it is more, the demand is more now. So probably you need 10 more plants like that to cater to the need. Yeah.
This is what I was just trying to find out, because one refilling plant with about 300 cylinders, Mr. Venkat also may know the numbers and the requirements because he has all fingertips all the time. So maybe the industry needs, because industry needs those refilling of the cylinders plants also. They also have multiple requirements. So that is what I just wanted to understand. Just to set up a refilling plant, it takes about 60 days to set up is what you're trying to say, right? Minimum?
Yes. If it is done on, minimum, even if it is on a what food basis, all civil work and mechanical, everybody have to work together hand in hand. Then it takes 60 days plus.
This Andhra Pradesh Medtech Zone is actually an integrated hub where they have many things in place. The infrastructure is in place, and they have a plug and play kind of a system. So many things are in place in Medtech Zone. So maybe you're able to do it much faster. The same plans have got to be
Yes,
set
yes.
up outside, and other places and things like that. Maybe the timelines may be more.
Definitely, definitely. Here we get a maximum support from AMTZ. Dr. Jitendra Sharma is all out for us. That's able to do it in 60 days.
Yeah,
Otherwise,
that's because it's an
more.
integrated hub. Many things are already in place and been created. Actually, that is one of the reasons.
True,
And
yeah.
we're just trying to understand that part of it. And another question that again I wanted to ask both of you by chance. Okay, now in addition to Medtech Zone, Mr. Purushothaman, do you have your plant anywhere else? It is the only place. Oxygen concentrator, where are you setting up?
It is in MUB. See, there are inside the AMTZ.
Oh, it is inside.
Inside that, it is the location is MUB, medium
fine.
unit B. Okay.
So your concentrator manufacturing is also inside that only.
AMTZ.
Okay, fair enough. So your refilling plant is also in Medtech Zone.
Yes, that is a different and this is different.
Yeah, that's fine. But all are situated inside. So I'm just trying to look at we are trying to understand the rate structure that's available for the industry actually.
True.
Thank you so much. Thank you. So my next question again to this Venkat did answer most of the questions. He did answer the questions. Ms. Venkat, I would like to know, like you did mention that the hospitals may use oxygen concentrators. Anything is acceptable because there is a need. I want to understand what exactly that hospitals need. Do you need concentrators, or do you need cylinders refill plans, or do you need PSA plans, or do you need, we are getting a lot of requests. I saw a request yesterday where a hospital is asking industry for the oxygen tanks, the cryogenic tanks, some spare capacities if it is available with the manufacturing sector, whether hospitals can use those tanks to store their oxygen also. So what is it that actually hospitals need? What's your immediate priority now?
So, well, I'll tell you something, Rama, here is most of the, they're all very capex intense. Okay. And you have high attrition. Okay. And even the operating costs are too high in hospitals. So the hospital, other than large hospitals, okay, any hospital which is beyond 300 beds, etc., they have certain don't have limitations and capex, etc. Okay, so they put the best of possible things because they are tertiary care units to take risk. So they have the best infrastructure in place because they standards for themselves, so they have to comply with that. But most of the healthcare is still a very unorganized sector in India because of it is in rural and semi-rural areas and semi-urban areas. Most of our healthcare is there. If you see, the issue here is not about availability of oxygen. In fact, India produces oxygen. Only 1% of that is converted into medical oxygen. Even today, we don't have dearth of oxygen's production. Production is very much available. We can produce for even 2 times the load that we are requiring, or 4 times the load. But it is not evenly distributed geographically. That is point number 1. So when it is not evenly distributed across the geography, then the transportation is the issue. Only you have to transport it from one location to the other. If you have to transport, then you need cryogenic tankers. Okay, and cryogenic tankers are not like lorry, okay, that you can make it on day one. Okay, they have their own scientific specifications. Unless you do that, and there is a process to come out from the factory, so it is not possible, okay, to make hundreds of cryogenic tankers immediately and put them on the lorries and transport, okay, unless we have some help from some international organizations. So from within India also they are trying to manufacture, but it will be too late. In the first wave we have seen, we were struggling for masks. we were struggling for PPE kits. Okay, nobody talks about that today. We have ample number of them. You get it for 2 rupees, what we bought for 30 rupees. You are getting today for 2 rupees.
Yes.
Okay, but the surprise comes in a different way today, and we don't know what is going to happen in the third wave. Okay, it may not be oxygen, something else which we are not prepared for. So what is the limitation today? What is the infrastructure limitations that we have in the hospital is, so most of these hospitals, they try to cut corners in infrastructure development. Okay, they, not every bed requires oxygen supply in a normal course. Okay, in every hospital, okay, other than those tertiary cares what I am talking, where a bed will be having an oxygen, most of the hospital will confine to only 20% or 30% of the beds for oxygen in only critical areas like casualties, theater complexes, and your post-operative and ICUs, etc., or high dependency areas. And depending on that, okay, they also create their infrastructure for the oxygen bank. Oxygen bank is where the D-type cylinders were connected, and then they will be opened so that the centralized oxygen can be supplied across the hospital. This is one. Recently, most of the hospitals have started taking up these cryogenic tanks. 1 KL to 6 KL tanks are available. 1, 3, 1, 2, 3, or what 1, 3 and 6 KL tanks are available. But hospitals, again, because everything comes for a cost, okay, depending on their consumption pattern, they go to the minimum possible one available, because there is no problem in a normal course for refilling these oxygen tanks. So they have this minimum requirement for what do you call, the oxygen manifold room, and they will also have minimum requirement of storage for tanks minimum. That is how the CEOs are also trained nowadays. We have to see cost cutting, not just in healthcare, in every industry. That is how it is, isn't it? So now what is happening is, you take a simple example. You are staying in an apartment complex, you have 40 houses. Okay, the pipeline, the plumber will lay a pipe so that a particular pipe size only a particular pressure of water coming in. If you have a smaller pipeline coming from your main tank to these 40 houses at a given point of time, then the pressure will not be there. So similarly, what is happening, they have provided pipelines from the manifold rooms to these particular user points. Okay, those pipelines may not be in a position to give the same kind of pressure, because they were all the minimum quantity pipelines which are put. So the pressure is not coming to the endpoint. That is number one. Okay, even if you have or 30 cylinders or 40 cylinders, at a given point of time, 100 people wanting oxygen, the pipelines which are laid cannot take care of that pressure. So the pressure drops when it comes simultaneously to 100 people. That is number one. Number two is your capacity to store. You don't have the required capacity to store. So if you don't have capacity, your oxygen depletes very drastically and you don't have capacity. So your turnaround time for really refilling the oxygen is more, and that is not provided because logistic support from the producer is also feeble. So these are certain practical problems, okay, that the hospitals today are facing because of their own internal infrastructural limitations. Okay, so even if we have more cylinders coming, if the manifold cannot support, you cannot do anything. Even if the manifold support and the pipelining doesn't support, you cannot reach out to the patient with the right kind of pressure. Okay, if you don't have enough storage, you have supplier next door, but you don't have enough storage. Again, there is a problem because you don't have enough storage. It will deplete faster, and your TAT time will be increased. Okay, and there you will be landing in problem. These are the practical problems the hospitals are suffering today. How we can mitigate this? Yes, definitely to some extent. And one more thing I have to tell is, you have oxygen concentrator for every patient. Okay, then your nursing care has to be more. Okay, you need some your biomedical engineers, because there may be some problem because they are not accustomed to how to manage these concentrators. There may be some breakdowns. Okay, so you need manpower in terms of biomedical engineers, mechanical engineers, okay, the maintenance people, and then the nurses have to be accustomed, the doctors have to be accustomed. So already the healthcare fraternity is already burned out. Okay, so there are limitations in terms of resource mobilization also to take care of these things. Did
Thank
I
you.
answer your question?
Yeah, thank you. Thank you for that. Mr. Purushothaman, I'm just trying to understand from what Mr. Venkat has listed out about the limitations in the infrastructure. See, one is you're setting up something as a manufacturing unit at a it's at an external site or a third party site. There is a requirement and a demand that is also coming from hospitals about to set up PSA plants inside the hospital premises. So, do hospitals have the infrastructure to create that kind of a PSA plans?
Madam, first of all, Mr. Venkat has given a lot of information and I fully agree with him.
Yes.
And the manifold and the pipeline, they go hand in hand and it has to be scientifically designed. Otherwise, there is a limitation for the number of cylinders to be used. That is very clear. It has to be scientifically designed and executed. PSA plant, he was talking about the cryogenic tanks in the hospital, or in some places, they are using O2 cylinders. Okay.
Yes.
And PSA, if you ask me, that is the cryogenic tanks or the O2 cylinders, if they are the primary supply, there should be a PSA plant as a second line of defense, if you ask me.
Okay.
The reason is PSA plant produces oxygen out of air and electricity. So if you have electricity, you can produce oxygen, may not be 99.5%, maybe 93 to 95%. That is enough. Not all patients requires 100% oxygen. So a PSA plant, if it is there as a second line of defense, it is ideal. It is ideal. But as it involves money and it is a capital investment,
yes.
And hospital, the medical has become an industry now. Industry means it's an investment. If
Yes.
there is an investment, there is a return on investments. Everybody look into it. It's become a business here. So a second line of defense as a PSA plant is an ideal situation. Okay, if you are having a cryogenic, maybe O2 cylinder is a second line of defense, but that second line of defense, again, it is an external dependence. But PSA is not an external dependence. It is you have your place for an PSA plant. You need generators or electricity. You can produce your own oxygen. You not have to depend on external source. This is what I personally feel.
Yes. Now, see, today morning I was reading the Neyveli Lignite Corporation, NLC, has received a mandate from the ministry to set up a PSA plant. So they're setting up maybe two capacities they're talking about. They're setting up one inside the NLC hospital itself. They're talking about something like about 25 to 30 lakhs investment for one capacity and maybe 60 to 70 lakhs for another capacity. See, one is an investment. The question here is the space that is required to set up a PSA plant inside a hospital. Do hospitals have that kind of space?
The space is very important, madam, number one. Number one, the space is very important. If you are going for a PSA plant, a PSA plant is a service-oriented equipment, and it requires a lot of maintenance. The filters, there are so many maintenance as they.
Right.
So if you are buying an imported one, then you got to depend on all the spares and accessories. When it goes, you have to have a good stock for preventive maintenance program, because this has got some compressors and it has got a lot of maintenance. So you got to depend on them, and you have to keep all filters in stock. And there is an oxygen sensor that also measures the output of the PSA plant, which should be within at least more than 90%. So the preference is, if you are going for a PSA plant, you have to see the cost of investments, return on the investments, and how beneficial it is going to be. And if there are any indigenous manufacturers, we can get the spares across the shelf in India. Okay. So this is what I feel.
We do have domestic manufacturers for PSA plants is what I heard. And in fact, hospitals are asking for PSA plants also, some support from the industry also, basically. See, hospitals, technically speaking, the kind of battles that they're having today, one space being the constraint. I'm just trying to understand, can you set up this PSA plant outside the hospital premises as a standalone unit, or it has to be inside the hospital premises
Can
only?
be outside or it can also be inside depending upon the size of the plant.
And
If
that
the
is what.
space is too big, see, it should have ventilation is very important for this plant.
Right.
And this plant has to be set up in such a way where you get clean air. Okay.
Mm.
So internally, it's a small plant. It can be internal if it is 20 liters per minute or up to 80 liters per minute. Otherwise, it should be outside the hospital.
That is what. See, can you set up the plant as the PSA plant as a standalone plant, and then maybe with refilling options and supplying to the nearby hospitals?
No, that is not possible because the PSA plants produces around 6 to 8 bars or 9 bar pressure.
Okay.
Cylinders have to be filled with 150 bar, which is 150 kg per square centimeter. So you need a booster pump to refill the cylinders. That is very, very expensive, much more expensive than the plant itself.
Okay, so it has to be inside the hospital premises.
The plant can be outside.
Okay.
Depends on the size. But refilling of cylinders from a PSA plant, it's an expensive option.
Expensive proposition. See, these are the options that we are trying to understand. What is feasible, what is suitable, and things like that.
Yeah.
And because maybe there must be some low-hanging fruits kind of solutions to the industry also to look at the options. If the industry also, the non-healthcare industry has to come forward and try to help the hospitals, they should know the options that are available, the ideal options, good options, and the better options.
True, very true.
That is what. So how much does approximately masking? I was reading again about this PSA plans will cost about something like about 25 lakhs to 70 lakhs. Is that the one? Is that the thumb rule?
No, it is not the thumb rule. It all depends upon how many cylinders you want to fill in a day.
Okay.
10 cylinders, it is from 10 cylinders to 500 cylinders, you can fill from a PSA plant. There are some hospitals, they have got 2 PSA plants where they give rest for one day, they run the other one for the next day. So that when one is under service, the other one can be utilized.
Right. Venkat, do hospitals have PSA plants? Most of the hospitals?
Well, Rama, let me tell you one thing. As you said rightly, hospitals, most of the hospitals, they don't have space to accommodate these, number one. Number two is, even if you have a plant, it is a capex index. It's a capex inducing thing. And I don't know how many hospitals would be having that kind of money to shell out immediately for that. And space is definitely, because they are all hazardous installations. They have certain rules and regulations. You have to leave certain space, etc. So I don't know whether complying to the statutory requirements also need some time. That is number two. We have to go according to the situation that we are in at this point of time. See, anything which is going to take more than 3 months or a 3-month time period, it is not going to be of any help for this particular situation. Please understand. But these are important things. These are lessons. These will be these particular equipment or manufacture. We never heard of them or never felt the need of them all these days. But now we heard about them. We feel the need of these people. But every hospital should at least have some kind of a backup in the form of PSAs, at least from now onward. So in future, this pandemic can come and go. There must be something else which will be coming up. And we have to have some backup for the future. And every hospital, as a statutory requirement, as an industry colleague, I am telling you, you are also in many forums, that we should ensure, if a hospital claims I am a 100-bedded hospital, they are supposed to ensure that the oxygen requirement for that hospital should be for at least 50% of the beds, and it should be scientifically installed, not just for the namesake or something. So in such conditions, these things will certainly be of great help for the organizations. Okay, so this is something which is helpful for the next wave or in the course of time. Okay, but
Absolutely.
today we have to think of how we can um, get in and help people today. Okay, so there are three differences.
Yeah.
We have at almost 1.3 beds per every 1,000 population. That is close to around 15 lakh beds for 120, 1.2 billion population. But whether every bed is capable of managing these patients, no, not, because most of the beds doesn't, they're not capable of managing. How we can help at this point of time, how we are going to help at a later stage is what we are supposed to look at. uh, if you this lockdown plays a major role. It will control the rapid spread of the virus. So I want, even if it controls the spread of the virus, to balance between the bed requirement and the affected, that will solve most of the problems. That will solve most of, and that is what we are looking from, at least within a week's time. Okay, if that particular bed requirement to the infected, if that could match, okay, that would be a blessing in disguise at this point of time. That is number one. So magics may not happen, but if there is right kind of code of conduct from the citizens, and the government implements such and strict regulations, I am definite that the virus will come into that it will fall to that particular scale where we can balance and save patients, number one. Now, this is a time that we should not look at opportunities in everything. This is the time that we should come out. We are a war zone. Okay, we should come out voluntarily in a philanthropical ideology and help each other. So how we will come out and do it is, today it takes anything between 24 to 48 hours to get an oxygen bed. Many doesn't get even after 48 hours in places where there are no good healthcare infrastructures. In a place like Chennai, it takes around 24 to 48 hours if you have influence. Okay, but 24 to 48 hours, if a patient is in the house, is not given right kind of oxygen, and if the patient sinks in 48 hours, we can't revive him. That is how most of the people are lost today. So how we can help as an industry from your end, for the rest of the industries, is if you have, I'm sure, definite, okay, God has given you all riches, okay, that you can share and help with the mankind at this point of time, fellow humankind. So we can have oxygen hubs, oxygen concentrator hubs, okay, which are not hospitals. They can up to 8 liters, they will manage patients. We can have 500 of them ordered. We can have a stadium taken. Okay, we can have electricity points given. They take only few days to create that kind of a thing. We can have these 500 people taken care for we have we'll create a clear SOP and mandate that this is only for the patients for transitory help. It's only transitory oxygen hub, which will take care of the patient between 24 to 48. And if it is anything beyond, there are constraints. Okay, it is not a foolproof method, but still, okay, we can save some lives by doing that. They will be in a controlled environment in such hubs rather than an controlled environment elsewhere. So that is one thing which we can really help doing. The concentrators will be of great help if we can accumulate it. Okay, and as a philanthropical motto, if your industry can come out and set up in across Chennai or in any other part, okay, these hubs, that is one thing which immediately I foresee that you can do. Number two is, today, even if the hospital want pipelines, copper pipelining to be done to enhance the PSI to the endpoint, we don't have copper lines. We don't have copper pipelines available in the industry, medical grade. Okay, if any of your industries, okay, is dealing with that or is capable of making copper pipelines of medical grade, they can come forward and help. Okay, then resources. Even if there is a copper pipeline available, there is no welders who can do it. Okay, because there are only few people who can do the welding job. Okay, and they're already occupied elsewhere. It's the requirement is across India. Okay, so they're looking an opportunity, and that they're going everywhere. So if you have welders in your industries, okay, who are capable of knowing how to weld a copper line or lay a copper line, you can give these resources to us, okay, and they can help the hospitals to the rest of the work. Okay. Number three is, if there are any institutions where cryogenic tankers is not an easy job. Okay, you have to go through a lot of regulations and other things. But at this point of time, I am sure that the government will relax certain, play the catalyst role and relax certain rules and regulations, okay, to manufacture more. But that is a long-term objective, because you can't manufacture just like that. Okay, if it is possible, yes, you can do that. That number one. And you have cylinders, may not be necessary D-type cylinders or B-type cylinders or any cylinder for that matter, which is used for some other gases like nitrous oxide, or you are using for carbon dioxide. If a company is having 100 of them, you can adopt one hospital, okay, just paint them from outside black and white and then give it to them. Okay, so these are some kind of help that the industry can help at this crucial moment. How we can collaborate with each other and work at a later stage is, as Mr. Purushottam was telling, yes, most of this what do you call things, okay, most of the scientific innovations that we are talking about have been there for a long time. We are talking about telemedicine for almost 2 decades. Okay, nobody even, they know the strength of telemedicine, the need of telemedicine in a vast country like this, where healthcare is very it is not evenly distributed, but nobody cared for telemedicine. Okay, but today everybody talks about telemedicine. So the need is the one who invites, or the need only teaches us how to adapt to newer technologies. Okay, so this is we are in the need of some technology, and now everybody understands that there is something called a PSA, there is something called an oxygenator. So definitely there will be a good market profile for all these things, and may not be immediately, maybe in the next 2 to 3 months, once this curve ends, okay, people will be ordering and they will be getting, and that point of time we can definitely take help from the industry in whichever way possible. One more thing where you can also help us is, if there is any mechanism where you can also have this pressure enhancers. If any of your industries are into enhancing the pressure from the pipeline to the end point, okay, you can also provide us some things. But I was very impressed when Mr. Purushottaman said that the leakages can be arrested through a device. Okay, it's a very simple, logical device. But unfortunately, how logical, how much, how many can afford that 5,000? That is number one. Okay, even if they are more afford, okay, whether they have the mental aptitude to do that. Number two. Number three is whether you will be in a position to provide a lack of them in a given point of time, because hospitals will be seeing only a month from now. After that, for them, they see that this is not going to be of any help. It's my opinion as of now. The chairman of Andhra Chamber of Commerce is here, and all the office bearers and other industrialists are here. So I have put up what could be done immediately. Okay, in the divine perspective of philanthropy, that you could do at this point of time, by contributing or establishing oxygen hubs, which will take care of 24 to 48 hours of a patient who requires oxygen, not beyond. We can, even if we manage 85 to 95 range, okay, you can save a lot of patients. Okay, that is point number one. Number two is, you can contribute in the form of skilled human resources who can work in installation of pipelines, manufacturing of this what do you call pressure gadgets. Okay, and also by contributing any oxygen cylinders that you are having. So we because experts say that this is going to be there for another month or so. Even if it is not month, it has to end in next 1.5 months or 2, because scientifically herd immunity will definitely come. Today we talk about one infected patient might be giving it to nothing less than 20 people who are contracting it as asymptomatic. Nobody knows about it, the real numbers. Okay, so we have to trust and believe. If that is the case, then in next 2 months, automatically there will be a huge number of Indian population that will be affected with this virus asymptomatically or mild, and that will create a wall and it will break the chain. Okay, so let us hope for the best. But in the meantime, okay, taking this opportunity, it is my humble request, and the chamber can decide upon this, and they can get back to us. As an industry colleague and being in the industry, I can loop you. I'm sure you must be also having great connects, okay? But still, I can loop you to AHPA or AHPA associated hospitals in various parts of Tamil Nadu and Andhra Pradesh, where we can coordinate and collaborate with them and do this.
Thank you. Thank you for that detailed inputs, and you have listed out beautifully the wish list of the industry. This is what we are trying to understand. What is it that is required? On one side, we don't have the basics, low-hanging ones, and on the other side, we are talking about huge manufacturing building capacities, like maybe your cryogenic tanks or whatever it is. Low-hanging ones, if we can actually address it, we can try to help the industry. It will meet the need of the hour. And I just wanted to check with you, Mr. Venkat, you mentioning about oxygen hubs. You mean to say that these are the hubs where they will create patient beds also, or it is just the manufacturing hubs you mean?
No. Manufacturing is not. I'm talking about the immediate requirement. Hubs is I'm talking about oxygen concentrators, around 200, 300 or 100 oxygen concentrators in each part of Chennai.
Okay.
There will be some beds, okay, 100 beds and 100 oxygenators. People will come and they will be on oxygen therapy.
It's like that is what, like a typical daycare kind of home.
It's a daycare, yes, yeah. It's not daycare. They'll be there for at least 24 to 48 hours. So my idea is that these hubs will be in touch with a consortium of hospitals.
Yes.
Okay, and whoever is in these hubs will be given preference in the hospitals as the hospital numbers go. So we will have a hotline between the hubs and the hospitals. So on a waiting list and on the depending on the requirement of the oxygen and worsening of the patient, the hospitals will give preference to these patients.
But
say for example, we have a hub in Tambram. Say for example, we have a 100 oxygen hub, 100 concentrator oxygen hub in Tambram, and we have around 10 in our so we have around 20-30 hospitals across Chennai in our group. Okay, on a daily basis there will be a hotline. People will be talking to them. They will be posting how many patients are there in the hub, and as soon as the hospital bed is vacant, then these patients will be moved to that hospital.
Okay,
so
right.
Something of that kind. Yeah.
Isn't the COVID care centers managing? I mean, don't they have this? We do find a lot of COVID care centers that are coming up now, and the hotels are also creating some facilities where they have a back-to-back arrangement with the hospitals. Can these be converted into hubs actually?
See, that is what I am trying to say. Most of them are looking at opportunities. Philanthropical work is different from opportunities. Okay?
And I agree. Right.
Yeah. Today, even if you convert a 5-star hotel into a COVID care center or a 3-star hotel, okay, not everybody can afford.
I got it.
Okay.
Right.
So this is a philanthropical work. Okay, whether he is a millionaire or a pauper, okay, he can come and occupy the bed. Right. So that is where we have to.
Right. Those are the business ventures. I got your point. Thanks for those are the business ventures. Maybe something similar because those they are all, we call them as hotels having back-to-back arrangement with hospitals. We are calling them as COVID care centers. Now the government of Tamil Nadu is also setting up a huge ones. As you said, they're creating huge capacities in Chennai Trade Center, in stadiums and all those places, and they're also creating some O2 beds. This is actually oxygen hubs is a very good thought process and a very good concept. It's very interesting also. Maybe yes. See, this is what we wanted. We wanted to understand from your side. Mr. Purushottam, let me ask you a question. Now he's talking about 100 concentrators, and then maybe some hubs where they can we can store about 100 concentrators, things like that. Do we have enough manufacturers in the country for concentrators?
As of now, we may not have. Maybe sooner or later. This is already a wake-up call for everybody.
Yes.
And we have to get ready to face the third wave. This wake-up call, there are many people coming up right now. And Venkat has nicely said about the hub. And I have a few suggestions. Apart from the hub, the O2 concentrators should also be available in airports, railway stations, bus stations, in the trains and in the compartments. What happened to those people who are traveling? They do not have to wait till they go to the hospital. They should not be deprived of any oxygen. Okay. So the portable oxygen concentrator should also be placed in all strategic points. That's what I personally feel. And madam, the situation is so bad. Nobody expected this situation will come like this. And we were thinking of manufacturing oxygen concentrators for the past 6-7 years, but we started only last year after the COVID. Okay. And after that, it was really challenging to bring it to 94% of oxygen. We got it up to 80, 85. It was very easy to get 85%. To bring the 85% to 94%, we all sweat blood for that. Okay. Now there are 5 liters, 7 liters, and 10 liters, and 20 liters. These are all the 4 different concentrators we are developing. The 20 liters concentrators will generate a pressure of 50 psi, though that can run ventilators, 3 ventilators at a time. Okay. So this is a wake-up call, and we have woken up, and there are many people probably they are manufacturing or designing. I am not aware of that as of now. There must be somebody doing in some part of the country. I am not aware of it.
Right. No, because it is the reason is we are importing. That is the data statistics that I'm getting, and we are looking at all this data daily published, and the import of oxygen concentrators is going up like anything. And so there are that's another side of the regulatory story and all that. That's an independent story, but we are importing more and more concentrators, in fact. And it is individuals started importing because they're getting gifts. Everything is allowed now. The statutory, this thing permits even, we can even get this concentrators as a gift now. So individuals are importing, and then NGOs are importing, and a lot many things are happening, and because they've just opened it up for imports. The idea here is not only for the treatment, we are also, maybe Venkat also will know, even post-COVID care also, patients are getting complications when they go home also. Maybe they need that oxygen supply for some more time, and maybe, they may require this also. So they are saying even after the treatment, now today we are talking about treatment and related options. Post-discharge also, they need this oxygen concentrators, and this is what I heard actually. I heard and I picked up in many of the conversations. So concentrators, yes, because this, the maximum request we are seeing is only for the concentrators actually, not just from the community, even from healthcare also, whichever format it is possible. I'm just asking, maybe I have to ask this question to Mr. Nandakumar.
Yeah.
You're CEO, you are a manufacturer, you have the technology. Now today we are talking about vaccines being delinked from IPRs. So we are just asking, we're not asking for your IPR, at least you have a technology with you. If an industry comes forward to manufacture, join hands for the manufacturing, maybe you can think about entering into some collaborative arrangements and agreements where there is a manufacturing unit, an industry which is willing to provide the space or their shop floor assembly lines or whatever it is, the space, the infrastructure that they have, the resources they can also bring and pull in. Maybe some kind of, see, your plant is in Visakhapatnam, Vizag, maybe your supplies can cater to the hospitals in and around the Vizag and Vijayawada or whatever it is. You can also collaborate and partner with other industrial houses and maybe the technology transfer agreements or arrangements, or you can be the technology partner, they can be the other partner. See, we're also trying to look at the scenarios where some scaling up and ramping up can be done, because the technology is with you, at least even for a temporary, because this is not their line. The manufacturers are not interested in setting up this permanent lines. Maybe as a stopgap arrangement for about 1 year, next 1 year, they wanted to create some, because the space is available, the land is available, they have their own infrastructure, maybe many things may be in place that is required. Maybe you can also explore and think about it. Maybe I should discuss this with Mr. Nandakumar also. I think such of these initiatives, see, for other industries, it may be like, as Mr. Venkat said, it may be a philanthropy, or it may be their social responsibility as a corporate, or it can be in some other form also, right? But they don't have the technology, or they don't understand what a concentrator manufacturing is all about. They can also support some of the manufacturers as fellow manufacturers. The idea is scaling up, ramping up. I will tell you the reason why. There was a conversation yesterday. It was happening for the last few days. All the imported concentrators, oxygen concentrators, the maximum imports are happening in the country. I'm touching upon the regulatory perspective. Most of the concentrators are imported from China. Okay, most of the imports are from China also now. And there were a couple of issues, conversations that I read about the quality and of the products is one this thing. Even I'm not even touching about the quality part of it. See, oxygen concentrators are medical devices, but currently they are not regulated, right? And they are not even controlled, come under price control of NIPA, NPPA, Pharmaceutical Pricing Authority. Now, but they are covered under your MRP labeling rules and norms also. So they are coming under that. That is the statutory side of it. So they are covered under Legal Metrology Act. So the Legal Metrology Act. But what the government has done it is they have dealing them from MRP and labeling. So what is happening in the last few days is there is no control on the prices on these imports, on the oxygen concentrators, which is affecting the consumers, the communities. See, there is a threshold limit, you know, the 2 times or the 3 times maximum of their landed CIF cost. Only that is the allowable limit under which they can sell it, but it's going beyond that. See, that is the problem with the imports are increasing, and then there is no price control. When Mr. Venkat is saying 1 lakh for a common man is very high. Can they buy a concentrator? It has crossed 1 lakh. These are the conversations, discussions I'm reading in the last 2-3 days. So when there is no MRP labeling, when the importers are dealing from MRP labeling, so what is happening is each piece should have the importer details and some pricing controls which are not there. So the ideal solution is one is the second wave, but we don't know about the third wave. How many of these patients, even who are stabilized in the hospitals, go home, require this concentrators? None of us know. During the first wave itself, we heard some clinicians asking communities, when we have senior citizens and all of them at home, many people, to buy a concentrator and keep it at home. This was one of the suggestion and recommendation. So manufacturing scale up and ramp up in the country is also required. Yes, this imports may be a temporary phenomena, but we need to look at a long-term perspective. Maybe we have to see how many manufacturers are there, and then maybe brands like yours should maybe look at some collaborative ventures with other manufacturers, and then industry can come forward with their own formats and ideas, but we need to scale up, ramp up the domestic manufacturing also. So we need to ask. There are some questions in the chat box. So the technology partners who have got the technology with them also can seriously think about joining hands with the industry. See, maybe for them, industry, for them, you know, see, for you, it's a business venture, fine. But for other industries, when they are joining it, for them, maybe it is a corporate social responsibility also. So they may not even look at it. They just wanted to help the hospitals and the communities to tide over the crisis. So that is also required. We can explore it. Maybe we will request Mr. Venkat, maybe when time permits, he's got a very busy schedule and tough schedules. I know that. He can send us a small note. Maybe we have the recording of this and we can also make our own notes, a concrete suggestions and things like that. And we will request ma'am to open up a similar discussion like this through our city chambers of commerce also, ma'am, slowly, gradually, maybe with other chambers and things like that. We need to convey this message, communicate this message to other chambers and industry associations also. Maybe there are ways and means in which industries can try to help the healthcare during this crisis time, and it is not helping healthcare, they're helping communities. Actually helping healthcare is, yes, that is only a route or a channel, but ultimately they are helping communities.
And one more thing, Rama, here is, see, if you have concentrator hubs, that is oxygen hubs. So today the numbers can deplete in one part of the country, and then there is another part, there maybe the numbers are high. Say, for example, Chennai may dip. So when you don't need them, you can easily transport them to another location and help there also.
Yes, you're
So
right.
that is another advantage that you have over that.
See, even I was talking to an anesthetist today also. He said even hospitals will not say no to a concentrator. As you rightly said, anything is what we can stabilize the patients at least. When nothing is available, a concentrator is also good to stabilize. And that is what it is. He was also mentioning. But that is right.
People are calling ambulances not to drive them to a hospital, but to provide oxygen for them. People are sitting inside. People are sitting in the oxygen because ambulances will be given preference in filling. So ambulances are coming home. Okay, I have an instance in Andhra Pradesh from one of my friends' relation. Okay, a boy of 28 years old. If I'm right. Okay, so they called an ambulance. The ambulance was, the driver was kind enough that he provided oxygen to him. The guy was there with the oxygen ambulance for almost 6 to 7 hours.
Yeah, that's true, madam. I've got few points.
Yeah.
Can I speak now? Yeah, I have.
Yeah, please, Mr.
One. Yeah. One is collaboration or partnership. Madam, Helix is not a cash-rich company. If you want to partner with us, we are ready to do so. Talk to Nandakumar, and I know how he is struggling. 1 year, he's almost sold a couple of his property, and we do not have funds. If there is a right partner, we are ready to have collaboration with them. That's point number one. Point number two, there are concentrators pouring into India. These are all service-oriented equipment. These machines have got preventive maintenance protocol. A preventive maintenance protocol is done in order to reduce the failure. The concentrators have got quarterly maintenance, half-yearly maintenance, annually maintenance, and maintenance overall, pump overall, because it is driven by a medical air compressor, which is service-oriented. If you are importing these machines, the spares and preventive maintenance kit have to be imported. Compressor can run only for 8,000 hours. After that, it has to go for a preventive maintenance. So in Helix, even we are manufacturing our own medical air compressor. That is the beauty of it. And there are many models are there. And the basic model, which is going to give 3 liters per minute oxygen to 5 liters, is going to cost not less than 40,000 rupees. Okay, that is the price. We have already done it, whatever is the market price. And third is that is the price about it. And this is what is going to happen. So many concentrators are coming. If they are not maintained properly, if a concentrator is working in a highly polluted area, maybe every month they have to change the filter and clean the filter or whatever it is. A pump overall is required every 6,000 to 8,000 hours. Okay, so this is what is going to happen. A compressor which has come, a concentrator which has come. As a service engineer, I have serviced concentrators. It requires replacement of compressor filters. If the air is highly polluted, it contains a lot of carbon, the filters will get clogged. That is a load on the compressor. The current will increase, that will increase the heat, and there will be a failure. So this is a service oriented that people have to keep in mind about the spares and accessories for preventive maintenance protocol.
Even that 40,000 rupees is not a small amount for a common man to buy a concentrator. We need to see whether any microfinance companies or any banks will even come and fund this. Actually, small EMIs where they pay the 500 rupees a month or 1,000 rupees a month. Okay, today that's a kind of a scenario. Just imagine large families.
When compared to the 1 lakh machine, sometime before you were talking about the machine cost 1 lakh.
Right.
Madam, give me the order. It all depends on the advantage of large scale production. Higher the number, the price will come down.
I'm just saying, frankly speaking, that small investments, just imagine families. So maybe they need
I understand
chambers where we need to look at multiple directions. Maybe we have to reach out, ask a banker to come out with some kind of a CA scheme or a SIBBIs or a banker to say that give all these things on a EMI basis where people pay just 1,000 rupees a month from their pocket and not more than that. So that won't pinch anyone. See, many things are the solutions. Importing is not the solution, is what I'm just trying to say. That's a very temporary phenomena.
That's
We have the domestic capabilities, manufacturing. We need to think seriously. I don't know how many of you have read today's Hindu. Today's morning Hindu carried a very small article about North Madras auto drivers offering rights to the patients, providing oxygen cylinders. So the drivers, there's getting this, it was created by an entrepreneur, a business owner in North Madras. And then it just picked up, started with 2 autos, and it's just going up. You know what they're doing? They just fit that auto with an oxygen cylinder. Anybody with a low saturation levels, I mean, falling levels, they're calling. And so they just get into the auto, they get that supply. It's kind of a stabilization. You know what they said the initiative is, when they don't get that oxygen supply, they're getting into a high panic mode, very high panic mode. That itself is actually creating in them. The moment they get into an auto, have stabilization exercise, you know, mentally they're very happy, and then they're ready. It is just that stabilization. See how people are looking at innovative ways of serving the community. Very interesting. Today morning I read it. So when that's not even a concentrator, right? So some of these are good solutions, and I must thank.
So we have an auto hub. What is preventing us from having? As Mr. Purushothaman, thank you so much. It was very, very nice presentation, and the inputs were very relevant. Okay, but one thing I should tell you: hospitals traditionally, okay, they do nobody else to survive. Okay, so we will not suffocate you in terms of getting the best price for our own survival.
No,
That is not the point. No, I'm telling you. So what I'm trying to say, this is the time, sir. Rajinikanth ஒரு நல்ல நல்லவங்களை சோதிப்பார் கடவுள், ஆனா அள்ளி கொடுப்பார் அப்புறமா. ஓகே, புரியுதா? அதனால நீங்க டோன்ட் வரி. ஓகே, you have been struggling, because that the problem in this country is intellectual knowledge is the least appreciated in this country. Sorry to say, it's a personal view, but I am telling you that is the list. Whereas I have a small story in 2 minutes I'll tell you. A gentleman goes to Ford Senior and asks, I want to do an internship for 5 days in your place. He allows him to go around his Ford car manufacturing. So he goes 5 days, he goes around. Okay, then he comes back to Mr. Ford. He says, the most perfect organization I have ever seen, sir. Why do you say that? Because everybody comes in time, everybody leaves, nobody wastes their time, the productivity is excellent, the organization is the best, all SOPs are actually performed and done perfectly. Then Ford says, thank you so much for your feedback. Then this young man says, sir, 1 minute, what happened now? I have one problem in the whole organization. What is it? This one gentleman who sits always in his cabin, okay, his legs on the table and crossed, and always smokes. He doesn't do anything. Okay, so other than that person, everything is perfect in your organization. Then Mr. Ford Senior says he is our chief strategist. His work is only to think how others should work. Okay, so that is the intellectual value that you give for an intellect. Okay, unless that strategist sits there and thinks the whole day, whether he is already spoiling his lungs by smoking, that's a different thing. But unless he sits in that room and thinks, okay, you can't make the 10,000 odd people who are working perfect. Okay, not look like that in this country. That is a curse for us. Okay, that is number one. So similarly, you go to any organization, it is irrelevant whether it is healthcare or a manufacturing organization. You go there and talk about innovation, AI, technology, everything. The first thing that pops out is how it helps the organization and the end user. No, it doesn't pop up that way. It is always popped out saying that how I can earn more out of this. Okay, so these two things are deterrent why we are not adopting to technologies despite having the best human resources and what you call best human resources and best natural resources to manufacture anything and everything that is possible across the world. It is on a very sad note, but I think things like this, these pandemics, are lessons that we are learning on a hard way, and I am sure the adaptability at a real time will happen at least in the future. And with great and good souls like Andhra Chamber of Commerce, I am definite that in some way or some kind, your help will be helping and saving lives. Thank you again for the great opportunity given to interact with all of you. And I look forward, madam, at any point of time, in any which way, I will be of help to your organization in being a catalyst, enhance the healthcare in the state or anywhere across the globe. I'll be most obliged.
Well said,
Thank you.
Venkat.
Thank you for that. Thank you. Thank you so much to both Mr. Venkat and Mr. Purushottaman for those rich insights and engaging conversations. We have also made a note of many of those suggestions, and maybe we have enough on our platter to go back and maybe put our thoughts together and see what can come out of it. Thank you so much. Now over to you, Vijay Lakshmi. Maybe any Q&A, some questions in the chat box alone, Vijay Lakshmi. You can just quickly go through that, please. Yeah.
You want me to go through that, ma'am? Actually, some of them are already answered.
Answered. If they're already answered, that's fine. Then we can now.
Yeah, and only thing is that one question is that is it not possible to arrest this leakage problem? Yeah, that has been answered, and the webinar this and all has been answered. And last question is that Rama madam, can you ask the CEO what he is looking for scaling up?
Yeah, we need to ask. No, we need to ask the CEO of Helix, Mr. Nandakumar. That I will just. We will speak to Mr. Nandakumar. We will connect. Those of you who are interested can write to Vijay Lakshmi at the chamber. Maybe Vijay Lakshmi, you can just share your email ID. Chambers.
Sure.
Reach out to her, and then we will connect them to Mr. Nandakumar, and then see how it can be done.
Yeah. So thank you very much, ma'am. I have shared my mail ID there, and people who are interested, please, feel free to contact us, so that definitely we will be in touch with them. And I really want to thank Ms. Rama madam at the outset, because the speakers are so good that it is like you have made a very good combo of the speakers. That's all. I mean, the panelists, I would say that one has got a very good knowledge about the technicalities of it, and then he has thrown open all the details about oxygen create this one, and the other one has very well explained about the functionalities of the oxygen crisis. Thank you very much. The speakers were so good, and the presentation is very informative to all the people, which is definitely the need of the hour. And I thank Ms. Rama madam for the excellently moderating the session, because she has been in the healthcare center, so no other person can be a better moderator than you, ma'am. Thank you very much for that. And this as Mr. Fanidar was saying that we were only thinking about oxygen crisis, but I see that lot of opportunities for the pressure enhancers, welders, and small things also. Yes, Ms. Rama madam said that lot of things and lot of suggestions in our platter. Now it is for the chamber to look upon as to what is that. The chamber can immediately take it up. And definitely the industry people here also can, ponder upon the thoughts that has been put forth by Mr. Fanidar and Mr. Purushottaman, so that what way that they can, whether they can give their services, or whether they can give the facility which is available in their factory, or whether they can provide the infrastructure for the factory to start something on, to solve the crisis immediately. And as a token of appreciation, on behalf of the president, we would like to present a e-memento to the panelists today. Ms. Madhuram, can you please? As a token of our gratitude, we would like to present this e-memento to the speakers, Mr. Purushottaman. We'll be mailing it to you. Sorry that we could not, give a physical memento to you. So we are just forming this.
That's fine. That's fine.
Yeah, so
at
we'll
this
be
point,
sending
anytime any of you require any of my services,
thank you.
All my capacity.
Yeah, so nice of you, sir. So nice of you. And then the memento to Mr. Venkat Fanidar.
Thank you.
Thank you so much, madam. Thank you so much.
Excellent session. It was very good, very informative, and very useful to the participants in today's scenario. And this can definitely be communicated to the other people also who are in need of this. And thank you, Ms. Madhuram. And I would like to thank the president, amidst this lockdown also, she is able to join us for this program. Thank you, ma'am. Thank you for joining us this program. And I thank all the executive committee members and the participants for joining us at this point of time. And there are many questions. Again, I know, as I understand, that there is no deficiency of oxygen production in the country. It's about prioritizing the diversion of supplies towards. Yes, of course, there is definitely production is in place. Only thing is, it is something like channelizing or streamlining it is more important. Definitely will put forth this. And the presentation as well as the the recording of the session will definitely be sent to all the participants, whoever has registered and whoever has participated in today's program. And I thank all the participants, and I thank the panelists and Ms. Rama ma'am and the president for joining us. Thank you very much.
Thank you. Thank you so much.
Thank you so much. Thank you
Thank
so
you,
much.
ma'am. Thank you for accepting the request for the program. Thank you.
Thank you, ma'am.
Thank you. Thank you.
Thank you very much, everyone.
Thank you, sir. Thank you, sir.
Thanks for the opportunity.